Yes, my name is Dr. Attanti, Srinivas Attanti. I'm one of the cardiologists with Citrus Cardiology, and I've been here for the last 8 years now in Villages, Leesburg, and Inverness, 3 places we go to. We're going to just talk about the most common cause of death in US and rest of the world. Is number 1 killer is a heart attack. Can you hear me now better? Okay, it was just him. How about now? Oh yeah, better. That's better, thank you. So what is the scope of the problem here? How many people are at risk? And what do we see in patients? Once they come to the hospital, to the doctors, that they have a heart attack or diagnosed with a heart attack, it's very few people what there. In terms of percentage of people will be at risk of the heart disease compared to people who present to us with a problem. That means after the problem has occurred, is about 2 to 3 million people on the top of the graph. Only it's like the tip of the iceberg. What the people at risk are much, much higher, 50 to 60 million base people at risk in the US. So those people, or my goal of coming here talking to us, to you, is to know the symptoms of this problem and get screened before it comes to the hospital, before it becomes an emergency. That's what we're targeting now. Office-based screening is there, home-based screening is there, based on the history and your risk factors and symptoms. So that's the number 1 leading cause of death in the US is heart disease and blood vessel disease. Number 2 is cancer. All other together is number 3. So it's a very big problem we have here. So how does it progress? What does the patient develop? How does the heart attack happen? Mainly by developing a plaque that slowly grows within the arteries. Over the several years, even decades, it takes to develop into a blockage or plaque in the artery, in the wall of the artery. That's where you see the plaque build up. And when it plugs, it also, when the plaque builds in the wall of the artery, it also grows outwards. We call that a positive remodeling. To maintain the lumen inside, it grows outwards also. After a certain time, there's no further growing outwards and quickly grows inwards when they're having the symptoms of heart disease like angina. If it is slowly getting worse, you may not see the difference on a day-to-day basis. But if there's sudden change happens in case of the heart attacks, why it comes suddenly is that plaque, one of these plaques rupture. They break. When this breaks, it's like a cut in your skin. When you have a cut in the skin, blood tries to clot on that area to stop the bleeding, to stop the injury. So the platelets get activated when this raw surface under the plaque gets exposed. So the blood clots immediately there. Within 10 to 15 seconds, it clots up the whole artery. That blocks the blood flow suddenly, which can be unpredictable. Nobody can predict it. So suddenly it can happen in any artery. If it happens in the heart, yes, you have a heart attack. If it happens in the brain arteries, it's a stroke. So it's underlying mechanism for both is the same. The plaque rupture followed by clotting on this plaque, ruptured plaque, developing a blockage in the blood flow within a few seconds. That's what happens. That's when you present to the emergency room, call 911. So what is the symptoms? How do you know you had a plaque rupture? This is the ruptured plaque, how it looks. So which plaques rupture more? What are the people with which of the plaque? There are several plaques that develop in the body. The ones which are lipid rich, is a soft plaque, are the ones likely to rupture. So the disruption of these plaques responded by the body or immune system, a clotting system, by thrombosis or clotting. That's what happens to occlude the artery here. So this is a plaque rupture. This is a microscopic picture. And then this red color is the clot, thrombus. Okay. So what are the symptoms of a heart attack? A lot of people think that they are going to have chest pain. It's not really a pain. It's not like a sharp pain, or it's not like a stabbing or a pin or somebody crushing. It's more of a heaviness, a pressure symptom. Any of you had a heart attack in this room? All right. My father had a heart attack. He described it as somebody sitting on his chest, somebody squeezing him inside. It's not the pain, it's a heaviness, very discomfort feeling that persists, not relieved with resting or nitroglycerin. It continues to have, because nitroglycerin is not going to dissolve the clot. So it's a continuous ongoing pain that causes heaviness that's persistent. It's not going away. A feeling of an elephant sitting on the chest, that's the most commonly described. And it's also associated with sweating. You sweat a lot, and there'll be shortness of breath, and also there'll be nausea. Some people have vomiting. So they think it's a gastric upset. So people who have a blockage in the right side coronary artery or the bottom of the heart, they have more symptoms of stomach-related symptoms. They think it's a gastric upset. They have indigestion, but in fact, it's a heart attack, symptom of heart attack. If something doesn't go away with vomiting or nausea that's persistent, seek attention. Call 911. The best option to do that. So tightness, some people may not have this classic description of what we say. This is what 60% of the women do not feel classic symptoms. So men more commonly have the classic description of what I described there. So what are the uncommon symptoms that can easily be missed by patients and also by doctors? Patients come to the hospital with a problem and we can still miss it. Heart attack. The reason is that they can have some jaw pain, some toothache. I had a patient who went to the dentist and he diagnosed that it's not the tooth looked perfectly fine. Then he sent to the ER, his patient having a heart attack because he was also having sweating there in the dental chair, having jaw pain, and then she's sweating on the chair. I said, no ma'am, this is not a dental problem. You got to go to the ER. And smart dentist picked up the heart attacks into the ER. So various other symptoms also can have throat tightness. They feel tightness in the throat. It doesn't go away with sweating and short of breath. And also I've seen people having neck pain, back of the neck, between the shoulder blades. A lot of people have different symptoms, but whatever it is, if it's persistent, not going away within a few minutes, 10, 15 minutes, and gets worse with exertion, you need to seek attention, immediate attention. So what else can cause symptoms? The statistics in the emergency room, when you see patients, you have 100 people come into the emergency room with chest pain or pressure, how many of them have heart attack, really heart-related pain? Only 1 out of 10 people have, the ER visits, have pain that come to the hospital with chest pain, have a really heart disease. So 9 other people have non-cardiac chest pains, not related to the heart at all. One thing that can really mimic like a heart attack, like sweating, goes away with nitro, is the reflux, acid reflux. Very commonly seen acid reflux. GERD, otherwise also called esophageal spasms. It's a smooth muscle. Esophageal, it's a smooth muscle. It's not used to having acid in the esophagus or the food piping. Acid belongs in the stomach. So when they have a reflux, it irritates the smooth muscle in the esophagus and they go into spasm. Different varieties of symptoms can happen with the esophageal spasm. Some people might have just burping. Some people might have just what you call as a nausea or a bitterness in the throat. And also can mimic like a heart attack, like somebody sitting on the chest with sweating, with diaphoresis, with this, everything like similar to heart attack. But when you do an EKG, come to the ER, EKG perfectly fine. So blood tests are negative, we send them home after a few hours. So it's a very common scene that can mimic like heart. Pleuritis, the rib cage, if somebody having pneumonia or coughing, flu, it can also inflammation of the pleuritis, pericarditis, the layers around the lungs and the heart can get inflamed and give pains. These pains gets worse with the inspiration. Take a deep breath, it gets worse. Because each time you cough or take a deep breath, it gets worse. That's more likely from the lungs. Muscle spasms, this morning I saw a patient in the hospital, came in last night, chest pain. What did he do yesterday? I played golf, no problem. I do it every 3 times a week. What else did he do? Something unusual. His wife was there next to him, said he carried 2 big cases of water bottles. 24 bottles from Sam's Club. They carried into the house from garage, into that. After that, he sat down and having chest pain. He pulled a muscle. He sprained muscle that causes him to have pain. Gets worse each time he takes a breath. It's pull muscle. So we just observe him, make sure it's not a heart attack, and send him home. Rib pains, when they have rib fractures with coughing, they can inflame. Nerve compression in the back. Some people have spinal stenosis or arthritis, pinching on the nerves that are coming out of the spinal column can cause pains. Infections, shingles, they come to the hospital, they're having severe pain, and open the shirt, remove the shirt, you see the shingles, all the rash there. And also pneumonia, the people get bronchitis, they get cough. When they cough heavily with the fever, they get sore muscles and they get pains. So how do you correct them? What are the risk factors? Who's prone to have heart attacks? Who's prone to have higher chance of having a heart attacks? What are some of the reasons we can correct them? Some of them we cannot correct them. What are the things that we can correct? Smoking. If somebody smokes, their chance of having heart attacks or a stroke is 10 times higher. And if they have it much younger age. So typically if I'm on call for the weekend, Friday to Monday morning, in the emergency room, if I'm on call in the emergency room, if I see patients, heart attack anywhere between 3 to 5 patients, most of the smokers are in the 40s and 50s. I see. Non-smokers, I see them in the 70s. So it brings them on much sooner. Quitting smoking makes a big difference to heal arteries also when they quit. Diabetes, very high risk of having heart attacks. They are also known to have silent heart attacks. They do not get symptoms. Because of neuropathy, the nerve system around the heart also gets affected. Not only the legs neuropathy, they also get neuropathy around the heart. They are more likely to have silent heart attacks also. Hypertension is another risk factor. High cholesterol, overweight is a risk factor. Physical inactivity, somebody who is not active at all, is a risk factor also. What are the things that we cannot correct? Something family history. You have a genetic problem, there's nothing we can do about it. Until we should be careful about the other risk factors. Men are more prone than women. For the difference, about 10 years difference, the hormonal protection estrogen have them delays them.